Good morning, Dr. Duffy. I so appreciate you taking the time from your busy schedule for this interview. And for our clinicians who are not familiar with Dr. Duffy, he is a very seasoned clinician in the nursing home. He has been working in the nursing home since 2006, correct? About 14 years. He is a clinical trainer and mentor actually for California. And I have invited him to do probably the most difficult interview in this series. And so I really appreciate you being willing to answer some of the more difficult questions around the experience we're having with the COVID-19 pandemic. And so one of the questions, or the first question I have for you is, as a provider who's well established in this field with this population and setting, what have you noticed in terms of the impact of COVID-19 and the pandemic on your patients? Are you seeing differences in terms of the psychological symptom presentation, in terms of what they're experiencing in your sessions with them?
I'm seeing a host of behaviors, emotions, sadness, anger, depression, loneliness, disorientation. I mean, the full gamut, really. I was even thinking about the Kubler-Ross stages of grief, because it is a grief. It's like a death. Their world has gone away, and we're in a limbo state. We have no idea when it's coming back. So it's difficult to reassure the patients. There is fear because there are conflicting reports on the television. I told one of my social workers, well, I heard we had 2 COVID patients go out. She said, I can't believe, where would you get that? And I said, from every single patient I saw today. And she says, we have no COVID patients. They were sent to the hospital for a different reason. But it had run through the nursing home like wildfire. So the anxiety is very, very high. The loneliness is very, very difficult because of the families not coming in. There's been a result of depression, sadness, anger, all the above. There's been a lot of weight loss. People are having nightmares. And there's actually some rebellion now. They're tired of being isolated, and they are acting out. So there are those behaviors on top of everything else that we've had before. So
and when you say rebellion and acting out, what are you seeing? What are some of the behaviors?
Patient-to-patient conflicts are escalating.
Okay.
Think about before, my patients are all isolated in their rooms now. They're quarantined with the doors closed. So where Mary and Clara never saw each other before, they now are stuck with each other 24/7. Clara's an extrovert, Mary's an introvert. Mary wants to be quiet and color. Clara wants to be at bingo and all the activities, which have all been canceled. So they're sniping each other. Mm-hmm. And the tension's very, very high between roommates.
And you're probably the psychologist for both of them.
Yes, exactly. And there's only the curtains, and I have to treat both of them very differently. And the sessions are all now focused in the moment, in the present, where there used to be issues from the past before and resentments and family things and all. It's all right in the moment today. And that's a huge shift.
Right.
And I'm trying to offer reassurance when I don't really have reassurance to give because everything is unknown. It's difficult to reassure someone when you can't give them dates. Not like we have an advent calendar in our hands and we can flip the little doors and know that Christmas is going to be there at the end. We have no end date.
You have no end date. How, I know you mentioned the loneliness and patients not having access to their family and friends. What would you say has been the impact of that in particular? I imagine that is one of probably the most painful, difficult components of this, obviously, in addition to the fear of being in a facility and potentially, individuals getting sick themselves or losing a friend or other residents getting sick. What's been the impact of not being allowed to have visitors?
I'm seeing more disorientation than I expected to see. I had one lady who had a visitor every day, every weekday. 2 ladies from her church, 1 golfing buddy, and 1 niece came on a regular scheduled day, and I was the 5th.
Mhm.
And the last time I saw her, she was very disoriented because she
Right.
could time her days by Audrey comes on Tuesday and Kim comes on Thursday. And the last thing she said to me was, I'm so afraid they're going to take you away from me too. One lady I had has made incredible progress from a major fall, lots of reconstruction in her legs and things. She was scheduled to move to Kirkland, Washington on April the 4th. Her family had set it all up. She was going to live near her grandchildren and great-grandchildren. Her daughter was coming from Ireland to facilitate all of this. And Kirkland, Washington, of course, is the hub of that first nursing home. So her daughter had to tell her, Mother, this is not going to happen. You're going to have to stay in California. We've canceled everything. And she was devastated.
We recognize just from everything you are saying with what's happening to your patients, how essential the behavioral health providers are, because there is such an emotional toll, an extremely painful emotional toll to what's happening to our patients. I'm wondering, the second question I have is, given all of these shifts, right? You said that people are focused on the now, they're anxious, they're lonely, they're feeling loss and grief, lots of discord with just roommates or behaviors or those challenges of being in quarantine and kind of that isolation that's happening. Have you had to shift your treatment approach? Do you find that you're needing to tap into different type of modalities or interventions, or is it the same as it was before? What's been your experience?
There has been a shift for sure. I'm doing a lot of damage control, which is unusual too. I'm trying to correct misinformation that they're gathering from the staff or from one another or from the news on television. I'm doing a lot of grief processing because this is a period of grief for these people. I'm doing some life review, as in pulling successful coping strategies from the past and unique outcomes, such as, do you remember a time when things were really, really, really bad and you dealt with it and you handled it beautifully and you really could pat yourself on the back afterwards? Those sorts of things seem to be beneficial. Some anger management, certainly, and how to deal with conflict and how to deal with these, what they feel is criticism, but really isn't. It's just another person's reaction and they're personalizing it. Do a lot of mindfulness now as far as, okay, here's some tools that you can use right here in your room. I had a lady said, when I look out in the hall, all the doors are closed, there's no staff, and it's quiet. She said, I feel like I'm in a Twilight Zone episode where you go out in your town and everybody's gone. And I said, okay, so let's look at what really actually is happening. Let's bring it from the hall back into your room and do the visualizations and the hearing tests and use all the senses. And that seems to really be calming to them. Yes, but very, very different. And some rational countering and some positive self-talk that will calm them down, that they can use right there without anything else, without requiring anything else.
All that makes sense to me. Probably one of the most difficult questions for us as healthcare providers, where we spend most of our energy and time focused on how do we heal others, how are you responding, right, to everything that's going on in the nursing home facilities as a provider? And what are you doing for your own self-care? Because I know with our providers that are in these settings with all of this increased emotionality, not just from the patients, which you and I focused on, but from the staff who are so stressed and overwhelmed and frightened and afraid for their patients. And we have facilities that do have patients that have passed away from COVID, or buildings that have a much higher incidence, right, of active COVID confirmed cases. Our staff have lost patients. Our clinicians have lost patients that they may have worked with for years or have been very fond of. And so I'm wondering, what's been your reaction and how are you managing to take care of yourself during this time?
I knew you would ask that question. That's not my strongest focus. I'm a nurturer and I take care of the patients. I do a gratitude exercise every morning before I get out of bed. When I first wake up, I say out loud because I want to hear it as well as think it. I verbalize everything that I'm grateful for. And it reinforces the fact that some of your world is still there and some of it is still intact. And I've taught staff to do this as well. I often offer that idea. I am isolating and taking all the precautions practically to an extreme because I want to protect my friends and my partner and my patients and the staff as well, of course. I am cooking more. I'm setting goals of things that I haven't done in the past, and I'm now making those things happen. I like to entertain. I like to cook and all that. I cooked Easter dinner, the full gamut, for one. And I set the table with the good china and the silver and all of that. And I did it for myself. It was sort of an I love me kind of gesture, but I spent the whole day cooking and did Easter dinner for one.
Dr. Duffy, I so appreciate your time again, and just your commitment to your patients and your facilities and CHE. Is there anything else that I didn't ask that you feel is important to share?
Just that I feel so grateful and so honored to be able to do what I do with the population I work with. And it's the tops of my gratitude list every single day. It's a gift. Thank you for the opportunity.
Thank you so much.